For more on where we stand with the vaccine, plus how to stay safe during indoor activities, we have Dr. John Torres and Dr. Natalie Azar. Good morning to both of you. Dr. Torres, let me start with you and dig in here. I guess most importantly, where do we stand right now with the vaccine, and what does the timeline look like for approval?
Good morning, Sheinelle. And with the vaccine right now, there are three major companies that have gone into phase 3 here in the U.S., Moderna, Pfizer, and the Oxford AstraZeneca vaccine. And they're starting to recruit people. They're going to get around 30,000 people each. They're going to give them either the vaccine or a placebo, and then they'll follow them along to see if they get the virus. If they get the virus, if they end up having less complications, which is what they're looking for, to find out about that safety and that efficacy, that effectiveness of the vaccine. This is going to take a while. This is going to take a few months. So when you hear that we might have the vaccine by the election or by the end of the year, a lot of experts I talk to are saying, maybe late winter, early spring before we start getting it, although they might get emergency use authorization that Dr. Fauci was talking about for some populations.
On that note, once the vaccine is approved, distribution will be the key obstacle. How will lawmakers decide who gets it first?
And distribution will be the big key here. And the National Academy of Sciences just came out with a recommendation looking at what they call 4 phases of vaccine distribution. And hopefully these recommendations are followed, but the CDC, Operation Warp Speed will be involved, the NIH to try and decide. And you can see right there, essentially what it breaks down to is the first phase are going to be healthcare workers in the front line who can't get away from COVID patients. They have to be there. It's going to be people with pre-existing medical conditions and the elderly who are more vulnerable. Then switch to phase 2. Those are more the critical workers, the essential workers that have to go out there to keep society working, but they might also be exposed. They might take COVID back home. And again, some of the elderly and those with pre-existing conditions. And then phase 3 are the children, some adults, and then phase 4 is essentially everybody. These phases mean that, obviously we can't give 330 million vaccinations all at once, so they're going to break it down into which group get them at what point, and hopefully we can get to that herd immunity, which means once we get to that herd immunity, then hopefully we can get the pandemic more under control, Sheinelle.
Finally, let me squeeze this in. I'm going to ask you what we call a water cooler question. I've never actually stood by a water cooler, but this is what they call it. A lot of people are worried that this is frankly moving too fast. So here's my question. If the vaccine was approved for emergency use, let's say tomorrow, would you be willing to get it in the first wave?
And Sheinelle, it depends on what the data comes out with, and that's what Dr. Fauci was talking about. Looking at the data, making sure that it's acceptable, that we've got enough through the phase 3, that we understand the safety primarily and the effectiveness of it. That's the important part here.
Covered a lot of ground there. Dr. Torres, thank you for your time this morning.